Hi, my name is Dr. Oleg Slupchinsky, and I'm a double board certified facial plastic surgeon practicing in New York City. This past October, I gave a lecture on custom carved elastic implants and ethnic rhinoplasty at the fall meeting of the American Academy of Facial Plastic Surgeons in New Orleans. The objectives of this lecture was to show other surgeons how to carve a nasal implant out of a celastic block, the principles of nasal implant insertion, potential complications, and case studies were reviewed. There's a lot of controversy on which is the best implant material to use. Over the past 15 years, I've performed many ethnic rhinoplasties, and I believe the best implant material is a custom carved elastic implant. The principal reasons why implants fail is not the material, but the fact that they're the wrong size and shape, they're improperly placed, and they are not secured. In the next couple of slides, I will show you examples of why implants failed. These are cases of revision ethnic rhinoplasty that I've performed in my office on patients who had previous rhinoplasties in the past. In this case, on a lateral view, we can see how an eye-shaped silicone implant has caused a polybeak deformity and a bulbous tip. This particular implant was the wrong shape and size, was not secured properly, and was put in the wrong tissue plane. This is a side-by-side view after the revision rhinoplasty with a custom carved silicone implant. As you can see, there's a nice transition in the nasal frontal angle in the after picture. The tip is less bulbous. The nose is much more narrow in the tip and in the bridge. On the lateral post-op and pre-op view, we can see that the bulbous tip and polybeak deformity shown with the black arrow has been resolved in the post-operative view after a custom carved elastic implant has been placed and secured properly. This can also be clearly seen on the 3/4 view. This Asian patient also had an eye-shaped silicone implant preoperatively, causing a polybeak deformity shown with the black arrow. In the post-operative view, she had a custom carved sloop implant or custom carved elastic implant placed, which was put in the right tissue plane, secured properly, and we see the resolution of the bulbous tip and the polybeak deformity. Moving on to the next case, we see a pre- and post-operative view of a patient who had a Medpore eye implant placed previously, causing width, bulbosity, and polybeak deformity to the tip. Post-operatively, a custom carved elastic implant was placed, narrowing the bridge, effacing the nasal frontal angle nicely, and refining the tip. In the intraoperative view, we can see how the Medpore implant is thick and wide at the tip end, or what we call the caudal end, and thin at the nasal frontal angle or cephalic end, whereas the custom carved implant is narrow at the tip and wider in the nasal frontal area. From the lateral intraoperative view, we can see how the Medpore implant not only is fractured in two, but extends past the tip, adds bulkiness and polybeak deformity to the tip, and as well, the cephalic end or the nasal frontal end does not fit into the nasal frontal angle well, whereas the custom carved sloop implant fits snugly into the nasal frontal angle and tapers off into the tip, preventing polybeak deformity and bulbosity. Again, the difference in implants is clearly seen on the pre- and post-op frontal view of the Medpore implant and the custom carved sloop implant. From the lateral aspect in the pre- and post-operative view, we can plainly see how the Medpore implant adds bulkiness to the tip as well as polybeak deformity, whereas the custom carved sloop implant starts at the nasal frontal angle and tapers nicely into the tip. In the next case, the patient had an L-shaped silicone implant placed that migrated forward and left a deformity in the nasal frontal angle as well as irregularities of the tip. Upon removing the L-shaped implant, a custom carved elastic implant was placed As you can see, there's a nice transition from the nasal frontal angle and into the tip. The next case is a revision case of a patient who had a Gore-Tex implant placed that also migrated into the tip, causing a polybeak deformity and bulbosity as shown with the arrow. In the postoperative view, we can clearly see that the polybeak deformity is resolved with a custom carved sloop implant. The frontal views as well show a nicer transition in the nasal frontal angle with the custom carved sloop implant, as well as refinement of the tip and reduction of the bulbosity within the tip structures. A 3/4 lateral view also shows the nice transition in the nasal frontal angle, reduction of the polybeak deformity in the supratip area, as well as reduction of bulbosity within the tip. The next case is a patient who had an L-shaped silicone implant that extruded through the tip. As you can see, there's an indentation at the tip. This has been repaired in the postoperative view after putting in a custom carved celastic implant. L-shaped implants that extend into the tip and columella have a high degree of extrusion and infection. This is why we do not recommend putting L-shaped implants as implant material in the nose. The lateral view shows a nice transition from the nasal frontal angle, extending in through the bridge and into the tip, as opposed to the pre-op view after the L-shaped implant was removed. This is also seen on the 3/4 view. As you can also see, the tip indentation has been repaired. The tip has a better structure and cosmetic look, as well as a nice transition in the nasal frontal angle and the bridge. The next couple of examples are cases of primary ethnic rhinoplasty that I've performed in my office. In this case, this is a primary surgery. We can see how the patient has a very deep nasal frontal angle that has been effaced using a custom carved sloop implant. Patients with very deep nasal frontal angles need quite a bit of augmentation, about 12 millimeters of implant material in the nasal frontal angle area, lifting and effacing the nasal frontal angle and tapering off smoothly into the tip. This can also be seen nicely on a 3/4 view where the nasal frontal angle is nicely effaced using a custom carved sloop implant. The next case example is a patient who had a deep set nasal frontal angle that was elevated using a custom carved sloop implant. As we can see, it effaces the nasal frontal angle and tapers off into the nasal tip nicely. This is the frontal view. As we can see, nice effacement of the nasal frontal angle, narrowing of the nasal bridge, and refinement of the tip. The 3/4 view demonstrates this as well. The next case is also a very wide bridge and very wide nasal ala. A custom carved celastic implant was placed, the tip was refined, and the bridge was narrowed, as well as the nasal ala. The lateral view shows even a slight elevation in the nasal frontal angle, elevates the bridge, refining the bridge and the tip. In this case, we see a very flat nasal bridge and a non-existent nasal frontal angle that has been elevated using a custom carved sloop implant. Tip and alar work were also performed. The lateral view shows this elevation as well in the nasal frontal angle, as well as the dorsum of the nose, extending nicely into the tip. The 3/4 view also shows nice effacement of the nasal frontal angle with a smooth transition into the tip. Another example of a elevation of the nasal frontal angle as well as the dorsum with refinement of the tip and the ala. The lateral view shows the elevation of the nasal frontal angle with smooth transition into the tip. In a 3/4 view, we can also see the nice transition in the nasal frontal angle into the tip. The last case also shows slight refinements of the nasal frontal angle, the bridge, and the tip. The lateral view shows slight effacement of the nasal frontal angle with nice transition into the tip. This concludes this lecture on custom carved tholastic implants and ethnic rhinoplasty. All the cases are 2 years post-op. There were no complications, no extrusions, and patients were very satisfied with their results. Thank you very much.